You cannot get a full breath in. You have tried and you keep trying. You take a breath and it stops somewhere and it will not go any further. So you yawn or you sigh and you try to force it. And you mentioned it once to somebody and they told you that it was just anxiety, or they told you it was stress, or they told you try box breathing. And here's the thing that you have never said out loud. It started after the surgery. You know exactly when it started. And nobody has ever told you why. My name is Joe Reed. I am the person you see when the surgery is done and the pain isn't. Your diaphragm is the single most important thing in your body that nobody tests. It is your primary breathing muscle, and it is also your primary stability muscle. Those are the same muscle, which means the way that you breathe and the way that you hold yourself up are the same system. Now, think about what happened when they cut into you. Your body needed the wound to stop moving. Breathing moves everything. So your body changed the way that you breathe. It shut down the deep part of the breath and it moved up into your chest and up into your neck. That was correct on day one. And nobody ever turned it off. So you have been breathing into the top of your body for years. Your neck is doing it. Your shoulders are doing it. And they are exhausted because they are doing your diaphragm's job. And you cannot strengthen your way out of it. You cannot strengthen something that your brain is not using. A man came to see me with a chest surgery from a decade earlier. And the scars are almost invisible. You would walk right past them. A physical therapist he was working with sent me a photo of him about a year and a half before he ever showed up at my door. She could not get one side of his chest to work. His left pec would not work, and she had just run out of ideas. I found that the scar was shutting down his diaphragm on that left side. I pressed my thumb into the side of his chest. And when you do that, the skin goes white, but the color should resume and come back to its normal color in about a second or two. His stayed purple for 3 minutes. I did about 15 minutes of work on that scar, and then I pressed on it again. 2 seconds later, and the skin returned to its natural color. He is breathing into that side of his body for the first time in over a decade. And his left pec muscle is finally working, and he can actually see gains in his chest for the first time in over a decade. Before you try anything, please listen up. If you have surgical mesh, skip this completely. Do not touch that scar. If your surgery is recent or the scar is not fully healed, skip this. If there's redness, there's heat, swelling, or any sign of an infection, skip this and go make an appointment with your doctor. For everyone else, here's a quick way to notice the blood flow in the area around an old scar. I want you to press your thumb into the skin on your forearm. Hold it for about 5 seconds, and then just let it go. You want to see that it returns back to its normal color. That is normal, but it also should be quick like that. Now I want you to press into the skin near a scar, beside it, not on it. Then let go and watch it the same way. You are not looking for a diagnosis. You're just noticing. Does the color come back the same or slower? If it is slower there, that area has been holding on to something quietly. If it is dramatically different, that is definitely worth mentioning to your physician. Either way, nobody has ever checked what is happening around the scar, and now you have. So here is where you go from here. You have 3 doors, and I want you to pick honestly. Some of you are across the country. Some of you are across the world. But there is a door here for you too. Door number 1. If you are not ready to pay anybody anything, and I don't blame you, there is a free reset experience in the description. One thing that you can try today. No equipment, no appointment, Test, reset, and then test again. Just go see if your body responds. It costs you nothing. Door number 2. If you want to know which of the 5 systems is covering for you, you can test all 5 yourself. Not with the scan, not with somebody's opinion. You feel the answer in your own body in seconds. That is the reset map. It checks the same 5 systems that I check in the room, and you can run it wherever you live. If you are not in California, this is where you start. It is also in the description. Door 3. And if you are done searching and you want my hands on it, the clinic is in Lake Forest, California. The details are in the description. And if I do not find something, I will tell you, and then we're done. I will not book you again just to keep looking. You've been carrying this a long time. You've been carrying it quietly because you were told to be grateful. You can be grateful and still deserve an answer. Both of those are allowed. Your body is not broken. It is misunderstood.